am fortunate to be here with Dr. Alban Ylli, who is a professor and epidemiologist in Albania and holds the title of professor at the University of Medicine, Tirana, and is going to share some of the amazing work in Albania in this area. We're very excited to have you. Thank you for joining us, Alban. Look forward to hearing about your work.
Thank you, Tatin, for everything and the fact that you made this possible, because it started because we got inspired by your work in Hawaii, and it is a very first attempt we're trying to explore this new domain of public health, and we hope it will be a milestone for other works in the future. So yeah, I'll start with my presentation, if you allow me to share.
Wonderful, thank you.
Okay, so it is about culturally relevant physical activity and the Albanian emigration. As I said, it's a first work we're doing here in Albania. We are aware about it, the gaps and limitations, but we hope it will be important in the future to catalyze interventions in public health and to change some of the ways we are doing public health now. Well, in this little work, we explore how Albanian folk dance serves as a culturally and regionally relevant public physical activity, both within Albania and among its diaspora, among immigrants. Yeah, we examine its potential challenges, opportunities for promoting active lifestyles. I want to mention the Synergy, Public Health Synergy project, which made this possible, and as I said, inspired this work. Well, why Albania? Why we try this first in Albania? Because it is related to folk dance and emigration. It's very specific work. In Albania, we have a long history of emigration since Middle Age. Yeah, we have some large diasporas. We call them old diasporas, South Italy, South Greece, in Croatia, in Black Sea, other countries. This is besides historical territories where Albanians live now, in Albania, Kosovo, Macedonia, and Montenegro. Now, at modern times, we have this problem of emigration, especially after the fall of Berlin Wall. And it is estimated that 1/3 of Albanian population lives abroad. So we have this new diaspora, 40% of Albanian workforce lives abroad. So we have to think about this. We have to study. We have to understand what's going on with our people in the world, and probably do some, think about public health interventions there. Yeah, we know that Albanians have strong connections to their traditions, which are especially expressed through songs, but folk dances are a unique form of identity among old and new diaspora. We did this little work via various techniques. Yeah, we did some scoping review for health and physical activity in Albanian diaspora. We try to explore, find cases, understand opinions, practices among some groups, especially older people. We're starting with older people in Albania, or folk dances as a form of physical activity. We also tried a quantitative survey about healthy lifestyles among some refugee groups already in Albania. We have already in Albania some sizable communities of foreigners, and I think they are growing. There are data to support this growing, and we have to think about them. This is for the first time we're trying to reach them and get information about their healthy lifestyles or risk factors. And we had in mind this folk dancing and physical activity potential synergies. Well, let's start with what we found in the literature. Actually, it was not a lot. We were not able to find any study focusing specifically on physical activity among Albanian immigrants living abroad. We found only a handful of studies exploring health and lifestyle among Albanian immigrants. And we discuss the so-called healthy migrant effect, which refers to the observation that immigrants often show better health outcomes compared to the counterparts of the host country or the people left behind in their home country, despite facing potential challenges related to the adaptation in terms of economic, social, cultural adaptations. Well, it's still debated, this healthy migrant effect. And in fact, in our review, we saw that Albanians abroad are not living any better than Albanians at home. In contrary, for example, in Italy, there were differences, and the health outcomes were poorer among large Albanian Italian diaspora. In United States, Albanian immigrants were becoming more sedentary and obese after settling there. In Greece, it's more complex, but I think this is enough to contradict the healthy migrant effect and start better thinking about, well, unhealthy migrant effect, which can serve as a basis for further interventions. And why not see the culturally relevant interventions for healthy lifestyles? Can culture help to promote public health? I think this is one of your questions in your project, and this is one of our questions for this work, and most probably for other works we're thinking about to carry out in the future. Well, let's show some of the explorations we've done with the Albanian diaspora. Well, first, the old Albanian diaspora. It's about Middle Age. It's about communities living in different countries for some 600, 500 years already. They still keep some identity. They are proud to show this identity. And folk dance is one of, important components of this identity. So they are attached to it. We explored the Arbresh in South Italy, Arvanitas in South Greece, and Albanian Ukrainians in Black Sea coasts. They are already Italians, Greeks, and Ukrainians, but they still have some identities. It's interesting to see that the folk dance in those communities is still Albanian, but there are differences because, of course, the traditions blend with, host countries' populations. But it still serves, and I have to stress this, to underline this, as a symbol of group identity. It's interesting that younger generations, under the modern influences of internet and television, etc., they still inherit some skills, some attachment to folk dance through generations, and they practice, they exercise this during religious or non-religious events or rituals. For example, during Eastern parades, during festivals, during weddings. Sometimes, especially where political and social circumstances permit it, they can also be learned in clubs, learned in schools. For example, in Ukraine, we noted that, or promoted in clubs. Well, it can be a large, let's say, area for discussion, the differences between countries, the potential there for including the physical activity as a rationale or of all, agendas of folk dance preservation as a cultural heritage. Different countries might have different opportunities. We see that European Union, as a club of rich countries in its origins, it's showing a lot of interest in promoting the minorities, promoting diversity, supporting regions. So regions are one of the backbones of the European Union. And this can be an opportunity for, trying to find synergies between traditions, preserving traditions, cultural identities, and doing public health interventions for physical activity. We noted that in some areas, for example, in Ukraine, it's very interesting. So they've been living there for 400 years. They're still proud, they're still interested, the younger generations, to learn the folk dance, to do it in schools. We found some cases when Albanian instructors from ballet or folk groups went there and instructed. They organized clubs, and people were happy to do that and used it. Again, I have to say this as a symbol of being a little different, being interesting. So you see, there is an opportunity for not the old boring public health, but a new, fun, interesting public health for especially for younger generations. Well, the new Albanian diaspora, the new area of research, new opportunities there. We found many cases of many models of Albanian diaspora being organized around clubs or associations and trying to preserve their identity for the sake of nostalgia sometimes, in other cases, just for the pride of being different, of having, some identity. And folk dances were part of those activities. They were mostly self-financed, not-for-profit cultural associations of Albanian immigrants. Well, in some cases, folk dances were not, let's say, part of organized, systematic events, but just spontaneous activities, like in parades, for example, for national days, people just starting to dance in the streets. And what I liked were cases in Germany very recently, during European Football Championship, when Albanian fans were dancing in the streets, typically were women, while men, other countries' fans, were trying to, to show off their, sportivity, their identity. They were dancing. So women were dancing. And what I liked here was the fact that those women fans were not just passive consumers of the show. They were exercising physical activity along with a professional physical activity played by, professional players. It's interesting to see that people see folk dance as an opportunity to exercise, to practice tradition and identity, but they would be, let's say, more than happy to practice it as a form of physical activity, as a benefit for themselves and society. That's that's the interesting part. Now it's about our research among older people. As I said, we did some qualitative research, some focus groups. It's not very representative of the country. It's mostly about active older people. What we noted is, that older people always, because, let's say this, well, among my, let's say, expertise is aging too, and I work with Albanian Association of Geriatry and Gerontology, and we work with older people associations, pensioners associations. We know what they like. We've been working together for advocacy and promoting healthy aging, care for the elderly, etc. So we have a lot of experience of older people. And we already noticed the fact that folk dances are an important part of their social life. This little research just confirmed this. Well, in a little introduction to folk dance, to all the viewers here, I want to say that it's not unique. It's not just one folk dance for all Albania. There are different ones. There are various ones. And older people like typically their regional, folk dance. They get connected to that. They like their specific local music. And those dances are different in terms of style, of skills needed, to practice them, and metabolic equivalent task as well, which is important for public health to understand and to, let's say, translate this cultural thing into a public health thing. Well, just to give you some examples, it's very popular in central Albania and Tirana, the Napolon. Well, I don't know if you noted in my first slide, the cover slide, the Child Harold picture. Yeah, the famous poem from Lord Byron, who visited Albania in the early 19th century. It was before the Greek Revolution, and probably he was, one of the early observers of Albanian folk dance. But yeah, for sure, he didn't find any synergy with physical activity at the time. So let's say it was during the Napoleon Wars, and this Napoleon name, it is connected to Napoleon Bonaparte. You know how it is, because the French coins started to enter, Ottoman Empire at the time, because the French fleet was there. Corfu was invaded by French. And those gold coins were used during the events, including weddings or parties, as a prize for, the best dancers. And, the name remains since those ages. So this Napoleon folk dance, it's more urban than what Lord Byron described. It's it can be practiced as in an individual, typically in couples, but you don't go in circles, like probably some of people know about Mediterranean or Southeast Europe dances, Greek dances, Slavic dances, Turkish dances, etc. They are very, popular. This circular. The Napoleon is, how can I put it? Is, harmonic, light body movements, and it's easy. This is important to say. So people can get involved very easily. You don't need practice at all. So of course it's very personal in terms of the harmony of the body. You have to move your hips and your hands, but it's easy. Myself, I know that, and I can dance this. Well, in South there is Pogoniste. It's like, again, circle dancing. I mentioned that. No jumping. It's uh, it's perfect for older people. You need to know it. It needs some skills. I pretend to know it, but I don't know well. So I cannot lead some of our colleagues in public health. Some of them, the former director of public Department of Public Health, and you met in the conference. He always goes, and take the lead. So if you know it well, you can take the lead. It's a moment of pride, of joy for the people, and but still, it's for everyone. It's slow. It's for everyone. The Cooksy dance, yeah, we mentioned that, and we talk with all the people, and we explore this. It's more intensive. It's again a circle one. So you start first, couple, then the others join. But well, some older people can do. Some of them adapt. Lots of jumping. Yeah, you have to run sometimes. You have to jump all the time. But it's important to keep the harmony of the group. So you need some skills. Not for everyone, but it can be easily learned. And I think younger people, girls and boys, are learning it. Well, as I said, for the old diaspora, it's inherited, and you learn it in your events. So every month there are events you potentially get involved in a dance like this. Well, I have to mention Tropoia dance. We raised this with older people. It's interesting. It's getting popular this year because just got listed in UNESCO heritage, and it's considered unique. It's not a circle dance. It hasn't. It has its own harmony, but it's very different for men and women. Well, another niche to explore in our research, the social, the gender differences. Men are not jumping. They make some kind of manly movements. Women jump all the time. It's very intensive. It's very intensive for women. And it's not typical, well, it cannot be, let's say, practiced by most older people. So older people said this. Well, Ximitropois is fun, but it's not for us. And I want to make a comment about the pictures. Yeah, as I said, we work a lot with older people. We had many cases when dances were part of our events, and we had a lot of pictures, but we didn't have a picture with older people practicing Ximitropois. So we had to go and find some professionals doing that. But in some of the pictures, you may know some of the guys during your visit in Albania. Yeah, for example, the second one in the lower picture, well, he met you. You talk about some statistical things with him. Yeah. Okay. What they think? It's the most, let's say, important physical activity for all the people. When we list it to them, other physical activity, this, by far tops the list of favorite, intensive. I have to mention these physical activities. Far ahead of jogging, cycling, hiking, which are very unusual in Albania. Still, let's say, traditional society. It's getting more and more urban, but all the people are reflecting, the years before. It's an opportunity for fun and socializing, and there are key added values. Well, it's popular, I said. Almost all older people practice at least one folk dance at least once a year. Well, there are some barriers. So it can be costly when you don't have, a venue. And sometimes you have to pay for the music. So the cost is something, but it's not high. Well, another issue discussed during our focus group where the events organized by municipalities, they are becoming popular. They are becoming, let's say, very systematic especially during summers, the so-called summer nights. Municipalities organize parties, live music in their, central squares, in partnership with private companies selling beers, etc. So they said, yeah, probably what you're saying we get from, let's say, dances as a form of physical activity. Some people would lose because they would take a lot of alcohol and unhealthy food. So we have to think this, we have to keep this in mind for any public health intervention in the future. Well, they said organizing events with folk dancing, it's the best form of them. So any kind of marathon or jogging or anything else, yeah, they would do for the sake of it or because somebody told them, but they would love in particular folk dance. And they mentioned even some specifics. For example, yeah, 300 euros for 100 people at the social club, it's enough. And it will go mostly for the music. Yeah, they mentioned when the music starts, you cannot stay still. Well, a few words for our unsuccessful attempt to measure the opportunities for, culturally, regionally relevant physical activity among migrants in Albania. We prepared the instrument. We started contacting the communities. Yeah, there are some examples. Well, I have to mention this. Yeah, we have a little town of some 4,000 Iranian refugees, which are in Albania since many years now, because of some international convention with the United States, Iraq, etc. So we wanted to start for the first time, explore their health conditions, risk factors, and talk about physical activity and opportunities for, these cultural and traditional things. It was hard. There is a lot of mistrust among those communities. So we have to work more, even with the Afghans. There are, a few thousand Afghans from Afghan war in Albania. Again, we want to do them and approach them, still to do some work. While with Italians, they are, sending in Albania kind of, 3,000 refugees per year. We still need to understand, all the legalities about it, and it will be something for the future. Another area to explore are, migrants working in Albanian economy, because yeah, we're feeling, the lack of workforce because of our emigration, and many, Bangladeshi, Philippines, African workers are coming and working in tourism economy, in construction. Nobody's thinking about their health up to now. So probably this will be an interesting, approach to find potentials for preserving their health by promoting traditions, either Albanian folk dance or their, traditional dances. Why not? Well, this is, this. I think you've done this. The first one to do this. It's a framework. It's a matrix which will serve to better organize all future analysis in this field. And there are two main things: the location of the study and focal population of the studies. One is the culture, the other is the place of origin. And we tried to put all the research we've done with Albanian dance into this frame, which can serve now as an example for others to work. And we know that Greeks, Slavs, Serbs, Bulgarians, Romanians, they will find similarities, and they can do their stuff, in this area. So, for example, the activity in the place of origin and activity in the culture of origin is the typical Albanian dance among Albanian residents in Albania, Kosovo, North Macedonia, or Montenegro, living in their historical territories. Activity not in the place of origin, but the culture is of origin. It's about Albanian dance, the folk dance in old and new Albanian diaspora? Well, there can be the cases I already mentioned, like activity in the place of origin, but not in the culture of origin. For example, the folk Albanian dance among refugees, immigrants, or tourists. In Albania, tourists are now a new thing, a new big thing. We're talking about millions and millions of them, much more than Albanian population coming every year. And some of them are eager to understand Albanian tradition. And why not use this interesting opportunity, to make public health with them? And well, the last one, it's another interesting territory. It's about activity not in a place of origin and not in the culture of origin. Albanian folk dance practiced by foreigners abroad, probably learned in a club or after visiting the country, trying to promote it there. Let me show you two pictures with my final slides. Well, for example, this one is foreign tourists dancing in Skanderbeg Square. It's becoming a common view. So they're doing in the places outside, they're doing in parties inside, they're trying to learn it. It's fun, it's joy, and it's public health. It's a good way of life. And the other picture is about American women going in a club for, I think it's about ethnic, so learning ethnic things, and they learned Albanian Kosovar dance there, and they're practicing it. So it's the case of your fourth, cell in the framework. Well, to finalize this, we know that there's a lot of work to do. We are hopeful that we'll continue with this. Yeah, we're starting already to do some work. We'll have time, for example, to share it in another event. The work we're starting with children, folk dance and physical activity. But to continue with this, yeah, we have to, why not measure metabolic equivalent task of various Albanian dance and promote it via media, make them popular, make people think about folk dance not just as an identity, as a tradition, as a fun thing, but a healthy lifestyle. Promote it with municipalities, with schools, from summer dancing nights I mentioned to cultural exchanges between diaspora clubs. We have to do more research. Well, we started with that. We have prepared the instrument. We have gone through the boards. It is already there. Yeah, early next year, we'll have for the first time a quantitative survey measuring opinions, knowledge, practice of Albanian children about folk dancing. And of course, we can further explore potential to work with refugee groups in Albania, understanding their attitudes. And finally, we have to share the data with international networks, like, public health resonance, and probably try to set up other regional networks about this culturally and regionally relevant physical activity in Southeast Europe or in Eastern Europe, etc. So you see, there are many opportunities for this field, and we believe let's say the future public health can learn a lot from traditions and culture. It's not all about technology. It's also about, let's say, revisiting our ways of living healthy in the past. And young people can learn from older people and vice versa. So it's all there for us to explore and do more fun public health. So thank you for this opportunity.